Every ambulance on the road is supported by an entire organisation. In the Netherlands, there are 25 independent regional ambulance services. They provide ambulance care within their own area. That always starts in the Ambulance Care Dispatch Centre. This is where the 112 emergency calls are received. Ambulance request calls are also received from GPs, hospitals and care homes. The dispatch centre operators have a nursing background. They can assess the situation quickly. They decide whether an ambulance is sent and with what priority. 112 callers are sometimes referred to a GP or out-of-hours clinic. While the ambulance is on its way, the dispatch centre operator gives advice and the first vital care instructions to the 112 caller. The operator also passes on all information about the patient to the ambulance while it's on its way. In the Netherlands, approximately 750 ambulances are stationed at more than 230 ambulance posts. The Ambulance Care Dispatch Centre operator always monitors which ambulances are being used and which are free. On average, 1.2 million ambulance trips are made each year, and this number is likely to increase. 3/4 of those trips are urgent. In a life-threatening situation, the ambulance with flashing lights and siren reaches the patient within 15 minutes. We call this an A1 trip. If there is no immediate threat to life, but a serious health risk exists, this is called an A2 trip. In that case, the ambulance travels without flashing lights and siren and reaches the patient within 30 minutes. Ambulance trips that can be planned in advance are called B trips. For instance, if a patient has a hospital appointment and may require complicated care during the journey, the mobile intensive care unit is also part of the scheduled ambulance care service. If no complicated care is required during the journey, the care ambulance is often dispatched. The important consideration in this case is patient comfort, which is provided by the care ambulance assistance. On occasions, the dispatch centre deploys a rapid responder. That is an ambulance nurse who travels alone in a small ambulance, on a motorbike or a bicycle. Some regions also have an ambulance boat or snow scooter. The ambulance has advanced equipment. The ambulance nurse has been trained to provide high-quality care at any location. The ambulance driver offers medical assistance and ensures the safe transport of the patient. They work as a close team and always according to national guidelines and protocols. If necessary, the patient is transported, following consultation, to a specialised hospital that may be further away. When the patient is transferred, all required information is exchanged. This exchange is increasingly being handled digitally, directly from within the ambulance. 1 in 5 patients do not require hospital treatment once care has been provided. They are often advised to visit their GP. The annual macro budget for ambulance care is approximately €525 million. The ambulance care service employs more than 5,600 professionals. You can always count on them, 24 hours a day, throughout the year. The ambulance staff cooperate with GPs, hospitals, care homes, mental health care services, domestic care services and midwives, and of course, colleagues from the police and fire service. The ambulance care staff are always ready, waiting and professional. Ambulance care. We provide it together.